This kind of stuff is completely avoidable.
Salt Lake County DA Sim Gill is talking about the felony charges filed Tuesday against Lori Meers, who was the primary caretaker for her 77-year-old mom. But back on March 10th, mom's twin sister came to the home, noticed the victim was in terrible shape, and immediately called 911. First responders say they found the victim was on the floor, covered in human waste. She was then rushed to IMC, where doctors found that the feces were days old. They went on to say that the victim was in poor medical shape and had obvious bodily damage, and that the victim was so cold she was hypothermic and it took them hours to warm her up. Cottonwood Heights police then began a criminal investigation.
She was sleeping on the floor, being fed on the floor. She was covered in her own feces and waste, and she was in a state of hypothermic shock.
As soon as he entered the home, one of the officers noted a foul odor of urine and feces mixed with food and filth. Then, during a police interview, Meers told detectives, quote, "This is nerve-wracking because I'm not stupid. I know exactly what you guys think or were told, and I don't blame the hospital for wanting an investigation to be done either, because they saw the condition of my mom, and it's sickening, and it's very sad and embarrassing."
Based on the totality of that conduct, as we outline in our probable cause statement, we charged one count of manslaughter and one count of aggravated abuse of a vulnerable adult.
Mears' own son telling police that his grandmother had been in a state of decline for years and that his mom was the primary caretaker. He also expressed his belief that his grandmother was neglected.
There is a category of vulnerable adults, and when we have those vulnerable adults, the care that we engage in or don't engage in, the neglect or abuse that happens at our hands, is something that is going to be held to a high level of accountability.
After a little more than a week in the hospital, the victim passed away on March 19th.